Lung transplant is a very complex, very labor-intensive and a very prolonged kind of recovery kind of a procedure where a large number of medical, paramedical, non-medical personnel are involved in giving new breath of life to one patient. Many of them are visible in front, but there is a whole lot of people who are not visible to the patient, but they play a very important role in lungs being retrieved from a donor hospital, brought to a recipient hospital, implanted into the chest of the recipient, and the patient making an uneventful recovery, going home, complying with the medications and making a good long-term recovery. A large number of people are involved in this entire process. So it's an expensive proposition, but the exact costs can vary from patient to patient. Initially, when the patient comes to us, we do a screening in the OPD, and those where on this rough OPD screening, we find the patient to be a possible candidate, we admit them for a detailed lung transplant evaluation to evaluate the rest of the organs and various other parameters to assess their fitness for this complex and major surgery. That process costs about 3 to 3.5 lakhs and needs admission for 3 to 4 days. Thereafter, the patient may be accepted for transplant, registered on the NOTO website and put on the waiting list, and ultimately when donor lungs become available, the patient undergoes the process of lung transplantation, recovers and goes home. Now, the cost during this period can depend and vary according to a host of factors which all cannot be clubbed and explained in this video here. So if you have a patient who needs a lung transplant, we'll encourage you to ask them to reach out to us, meet us physically, and we'll be happy to evaluate the patient, discuss, and then talk about the costs also to the patient when they are in front of us. Thank you.